Welcome to the Clinic Code, the podcast where we uncover what truly drives clinic success. Today's guest is someone who brings a fresh perspective to how clinics really operate. He's not just passionate about healthcare, he's dedicated to fixing the gaps that often go unnoticed. Dr. Ehab began his career as a dentist, but quickly realized that many challenges had nothing to do with clinical skills. They were operational. Today, he's a trusted advisor and a strategic architect, working closely with healthcare investors, founders, and owners to build clinics that actually work. Dr. Ehab, welcome to the Clinic Code.
Thank you, Monica, for the lovely introduction. I felt genuinely touched by your words.
Thank you. Let's start from the beginning.
Sure.
What made you step out of the treatment room into the world of operations?
It all started with one question. We have the best doctors, best equipments. Why aren't we growing? A discussion happened a couple of years ago with one of the clinic founders. I used to be one of his dentists, to realize that the problem was not in the treatment rooms. It was all around it. That minute changed my perspective. It was transformational to realize that the problem was lack of clarity of the staff roles and responsibilities. There were no standard operating processes, confusion among the staff. That minute, back to your question, I stepped out of the dental room and start to fix everything beyond it, fix the clinic engine.
What is a common hidden problem you see in clinics today?
One of the most silent issues is misalignment. Teams often work hard, but not in harmony. Everyone is busy, yet the clinic is not progressing. There is no clarity on who owns what. The result? Delays, mistakes, and stress. It's not a people problem. It's an internal system problem inside the clinic.
Why do some clinics grow financially but suffer internally?
Because growth without structure is a disorder. You can push for numbers, revenue, but if structure won't grow in parallel or is not aligning with this numbers growth, it will end up in staff feel confused, management will feel burnout, actually patients will feel that gap, lack of structure. Growth should feel smooth. It's not like everyone is just running faster.
You work with many founders. What triggers them to call you?
It's rare. It's rarely one problem. It's a build-up of small things together. Some of the examples like revenue is not growing, patients are not converting, staff are confused or they lack alignment. Those founders, they can't explain it as is, but they feel the weight. So that's the minute where I step in and help and assist.
What is an example of a small fix that made a big difference?
Actually, in one of the clinics that I manage, we clarified the roles and responsibilities of the front desk team, introduced their standard operating procedures, and before we introduced that, we map all the touch points of the patient journey. We sat with the front desk manager and the staff team member, because we believe any plan without a good communication and implementation of this plan, it will end up like just a paper that it will be archived and nothing will happen. So after we are done with all of that, imagine what, 24 hours after we implemented the new standard operating procedures, front desk mistakes dropped by 40%, patient waiting time dropped by 50%, with a significant improvement of total patient satisfaction in that clinic.
What advice would you give to a founder starting a clinic today?
Well, I would say start with structure. Before you hire, before you market, start with structure. Define your patient journey, define your staff roles and responsibilities, and your financial controls. Don't wait for things to fail to fix them. The clinics don't fail because of bad medicine. They fail because the engine running them was not built properly.
Anything else you would like to share?
The clinics are living systems. They need clarity, rhythm, and care, just like patients. Imagine that we treat our operation same way we treat our patients. In that scenario, clinics will not only grow, but also it will thrive.
Thank you, Dr. Ehab, for the valuable perspective.
Thank you, Monica, for having me today. It's a pleasure.
And thanks to everyone for tuning into the Clinic Code. See you next time.